Introduction: imagine a sudden tear, not in the fabric of your clothes, but within the very walls of your heart's arteries. This is spontaneous coronary artery dissection, or SCAD. It's a rare, yet serious, condition that can lead to heart attack, sudden cardiac arrest, or even death. Unlike typical heart disease caused by plaque buildup, SCAD arises from a tear in a coronary artery wall itself. This video will explore the complexities of SCAD, from its causes and symptoms to diagnosis, treatment, and ongoing research. Etiology: causes. The exact cause of SCAD remains elusive, making it a significant challenge for both doctors and patients. However, research has identified several factors associated with an increased risk. These include fibromuscular dysplasia, or FMD, a condition affecting the walls of arteries throughout the body, hormonal fluctuations related to pregnancy, particularly postpartum, intense emotional stress, extreme physical exertion, and certain connective tissue disorders like Marfan syndrome and Ehlers-Danlos syndrome. In some cases, SCAD may occur without any identifiable risk factors, highlighting the complexity of this condition. It's important to understand that these are associated factors, not direct causes, and further research is crucial to fully unlock the etiology of SCAD. Pathophysiology. Let's delve into what actually happens inside the heart during SCAD. The coronary arteries are responsible for supplying the heart muscle with oxygen-rich blood. In SCAD, a tear develops in the inner layer of a coronary artery wall. Blood then enters this tear, creating a hematoma, or collection of blood, within the artery wall. This hematoma compresses the true lumen, the actual channel through which blood flows, obstructing or even completely blocking blood flow to the heart muscle. The lack of blood flow leads to ischemia, or oxygen deprivation, in the heart, potentially causing a heart attack, arrhythmias, or other life-threatening complications. Understanding this mechanism is crucial for effective diagnosis and treatment. Epidemiology: SCAD is considered a rare cause of heart attack, but it is likely underdiagnosed. It disproportionately affects women, particularly those in their 40s and 50s. In fact, SCAD is a leading cause of heart attack in women under 50. While it can occur in men of any age, it is far less common. Recent studies suggest that SCAD accounts for up to 4% of all acute coronary syndromes, which include heart attacks and unstable angina. Improved awareness and diagnostic techniques are continually refining our understanding of the true prevalence of SCAD in the population. Signs and symptoms: the symptoms of SCAD can mimic those of a typical heart attack. These include chest pain or discomfort, often described as pressure, squeezing, or tightness, shortness of breath, sweating, nausea, vomiting, dizziness, and pain radiating to the arm, shoulder, neck, or jaw. Some individuals may experience atypical symptoms, such as fatigue or abdominal pain. The sudden onset and severity of these symptoms warrant immediate medical attention. Remember, time is muscle when it comes to the heart, and prompt diagnosis and treatment are critical. Diagnosis: diagnosing SCAD requires a high degree of clinical suspicion, particularly in women presenting with heart attack symptoms without traditional risk factors. The primary diagnostic tool is a coronary angiogram, an X-ray of the coronary arteries using contrast dye. This allows doctors to visualize the artery and identify the characteristic appearance of SCAD, such as a narrowing or hazy appearance of the artery. However, sometimes the angiogram findings can be subtle, and additional imaging techniques like intravascular ultrasound or optical coherence tomography may be necessary to confirm the diagnosis and assess the extent of the dissection. Classifications: type SCAD can be classified based on angiographic appearance, primarily using the Yip-SAW classification. Type 1 involves contrast staining of the arterial wall with no intimal flap. Type 2 involves diffuse stenosis of varying length, and is the most common. Type 3 involves focal or tubular stenosis mimicking atherosclerosis. There is also Type 4, which is associated with a thromboembolic event, and Type 5, which occurs in the setting of atherosclerotic disease. This classification helps guide treatment strategies and predict potential outcomes. Treatment and management: treatment for SCAD depends on the severity of the condition, the location of the dissection, and the presence of ongoing symptoms. In some cases, conservative management with medications like aspirin, beta blockers, and ACE inhibitors may be sufficient to allow the artery to heal on its own. However, if blood flow is severely compromised or symptoms persist, interventions like percutaneous coronary intervention, or PCI, also known as angioplasty and stenting, or coronary artery bypass graft surgery may be necessary. It is crucial to weigh the risks and benefits of each treatment option and make individualized decisions based on the patient's specific circumstances. Prevention: because the exact causes of SCAD are not fully understood, there is no guaranteed way to prevent it. However, minimizing modifiable risk factors is important. For individuals with fibromuscular dysplasia, careful management of blood pressure and avoidance of activities that could strain the arteries is recommended. Women who are pregnant or postpartum should be aware of the potential risk and seek prompt medical attention if they experience any chest pain or other concerning symptoms. Overall, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and stress management techniques, can contribute to cardiovascular health. Prognosis, recent research or advances. The prognosis for SCAD varies depending on the extent and severity of the dissection, as well as the timeliness and effectiveness of treatment. While SCAD can be life-threatening, many individuals recover well and return to their normal activities. However, there is a risk of recurrence, meaning that the dissection can happen again in the same or a different artery. Ongoing research is focused on identifying biomarkers for SCAD, improving diagnostic accuracy, developing more effective treatment strategies, and understanding the long-term outcomes of SCAD patients. New imaging modalities are being tested for more precise diagnosis. Registry studies are underway to gather more data about SCAD, which will lead to a better understanding of its underlying causes and improve the care of patients affected by this condition. It's important for SCAD patients to receive ongoing monitoring and support from a cardiologist experienced in managing this complex condition.